This question comes from email from Barbara. She writes, I'm 52 years old. I'm still in perimenopause. I still have regular monthly periods, but they are heavy and affecting my quality of life. What are my options other than hysterectomy to help me with this problem?
So a lot of people in the menopause transition will have heavy periods for non-cancerous reasons, so for benign reasons like uterine fibroids. However, whenever you're in that menopause transition, if you're having heavy irregular periods, your doctor always wants to rule out like a precancer or a cancer, so they may do some imaging like a transvaginal ultrasound. They may also talk about doing an endometrial biopsy where we just get a little bit of the tissue from the inside lining of the uterus to make sure there are no abnormal cells. So once we kind of rule out that bad stuff, then we can talk about how to control your symptoms. So it's going to depend on what's going on. Sometimes if you're a good candidate, we can do oral contraceptives with estrogen and progesterone. Sometimes we'll just do a progesterone. There are non-hormonal treatment options like non-steroidal anti-inflammatory drugs, or something I really like is an anti-fibrinolytic called tranexamic acid. Tranexamic acid works really, really well. It will really decrease that vaginal bleeding in a lot of women. Otherwise, if you have something like a fibroid or a polyp, your doctor may say, how can we go ahead and remove that? Or there's something called an endometrial ablation. It is a surgery, but it's an outpatient procedure. We basically go in the operating room, put your feet up like in regular stirrups, like a pap smear, and then we go in with a small device and we destroy the inside lining of the uterus. The goal is not to stop people from having periods with an ablation. It's for people to have normal periods. So sometimes that's an option, but sometimes after an ablation, people will stop having periods altogether. But it really depends on what's going on. And also your doctor will review your medication list to make sure that's not triggering something. But the good news is the average age of menopause is 51.4 years of age, so it should be going away pretty soon. Just rule out the bad stuff. Hang in there, girl.